Hello, my name is Charlene and I'm Warren's mom. We are coming from Cameroon. Warren was diagnosed sickle cell anemia at birth. He was born in Canada and months later we moved in Cameroon where he started to follow up. She told us when we reached Cameroon that Warren can be cured by going through a bone marrow transplant. And she also told us that she knows a very good doctor that used to treat a patient of hers there in Cameroon. She told us that the doctor was in India. So she talked to us about Dr. Gaurav Kharya.
So Warren came to us with a diagnosis of sickle cell disease, which I'm sure quite a number of you might be aware that it's very common in African continent. Rather, if we put together Nigeria, Congo and India, the sickle cell burden in these three countries form almost 1/3 of the global sickle cell burden.
Before bone marrow transplant, Warren was going through sickle cell anemia crisis, some complication. He had one accurate chest syndrome, which is a huge complication of sickle cell anemia. And every 3 months, he had some little bit complications of sickle cell anemia. So he was always going to the hospital and things like that, always have a huge anemia.
When we talk about increasing the life expectancy, making it normal, the only possible option is bone marrow transplant. So Warren came to us for a possible bone marrow transplant as a curative solution for sickle cell disease.
So we discussed about what, because I didn't know anything about bone marrow transplant. So he explained to me what the treatment was about.
We screened his siblings, so he has 2 siblings. Unfortunately, the little one, who was around 8 to 9 months at that point of time, was found to be completely genetically identical to Warren. So after some preparation for 2 to 3 months, after preparing the donor also, because as I've highlighted, the donor was very young, we took Warren for transplant, and by God's grace, he did pretty well. There were no significant challenges during the entire transplant process, pre-transplant preparation, the transplant and the post-transplant course.
Warren had his bone marrow transplant the 1st of April. Everything went well for Warren. First of all, Dr. Gaurav Kharya, I want to thank him because he's a very, very good doctor. He knows what he's doing and very, very professional. Also want to thank the sisters. They are so lovely. They made us feel like in home. We didn't notice that we weren't in Cameroon or in Canada. We feel like we were in home. And also the support team. I really, really want to thank all of you because you made us feel in home and you made this treatment very clean hospital, very professional team. So I just want to say thank you. And I really recommend Apollo Hospital and really recommend bone marrow transplant here in Apollo with Dr. Gaurav Kharya team. Thank you.
And as you can see, he's more than 100 days post bone marrow transplant. He's doing extremely well, free of any symptoms to sickle cell disease. Looking forward to going back to his country. So from Indraprastha Apollo family, we wish him all the very best in his life. Thank you.